Hello, is Dr. Smith there?
Yeah, this is Dr. Smith.
Hello, doctor, this is Dick Rivers in the CT department. One of your patients showed up here without anyone letting us know that they would be arriving here for a scan.
Oh, I'm sorry, Richard, it won't happen again.
Actually, I talked to you twice last week about the same issue, and you had the same response saying, "It won't happen again."
Oh, I'm sorry, it's just been so busy over here.
I understand, but when you don't call us, and the patient is totally unprepared for the scan, it makes us look like amateurs. Maybe if you didn't think of your CT order the same way you think of ordering a jumbo jack at the drive-through window at Jack in the Box, we won't look so unprofessional.
Oh, sorry.
Well, anyways, that is only part of the reason for this call. I will not be able to perform your scan until I get some additional info.
Okay, what do you need?
First of all, you did not specify if you would like IV contrast for this scan.
Well, it's to rule out appendicitis, so what do you suggest?
Well, usually that is done with IV contrast, but I cannot suggest anything really. It's a medication, and I'm no doctor, so it's beyond my scope of practice.
Well, okay, let's do it with contrast then.
Another thing is, this patient told me she had her appendix removed 10 years ago, so it's going to be a tad impossible to rule out a disease in the part of the body that no longer exists. Would you like to throw a different disease against the wall and see if it sticks? Perhaps we rule out gallstones on a patient with no gallbladder?
How about we rule out a small bowel obstruction then?
Great, that one's always good. I see your patient was sent over here with no IV and the patient's labs were never drawn. That's another example of your clinic's ruthless efficiency. So we are going to have to do that now, so it should be quite a while before I send the patient back your way. See now, if you would have called first, we could have resolved all these matters prior to the patient's arrival and we won't look like a couple of douches.
Oh, don't send them back to me. I'm leaving in a half hour. Just have them follow up in urgent care.
Well, that's pretty convenient. Did you call urgent care to notify them that they will be receiving your patient in their already completely packed waiting room?
No.
Well, what did I expect, Doc? I must say you have the foresight and the skills to work efficiently. That's rivaled only by your refusal to conceive that anyone matters outside your little clinic.
I don't get it.
Oh well, I guess I'll talk to you about the same shit next week. Have a good evening, doctor.
Yeah, you too.